Hi, I'm Dr. Harry Oken for Columbia Matters. This month is Colon Cancer Awareness Month. And because of that, we're going to talk about strategies for screening for colon cancer. Unfortunately, colon cancer is a common cancer in the United States. 1 out of 20 Americans will get colon cancer. 1 out of 10 Americans will have polyps. Polyps can be the precursor to colon cancer. So detection and detection early is very important. Now, who should get screened for colon cancer? Well, colon cancer screening begins at age 50. However, if there's a family history with a first-degree relative, brother, sister, mother, father, then you want to get screened 10 years before their diagnosis. So if your dad had colon cancer at age 54, you would get screened at age 44. In a prior segment, we talked to Dr. Kester Cross, who explained the screening colonoscopy procedure. When you're doing the colonoscopy, you're using a flexible scope, and you're entering the rectum, and then take us through it.
So we take a flexible scope after you've done a liquid purge, so the bowel preps are the evening before, give you a laxative, cleans the bowels out. That truly is the hardest part. And we take a flexible scope through the rectum, navigating through this 4 feet of colon, looking for, in this case, or this patient here, would have an asymptomatic cancer, meaning no symptoms at all. This person will be walking around having a stage 2 out of 4 cancer with no symptoms. Liquid stool comes in the colon here, would solidify. They'd have a bowel movement, no bleeding, feel fine. Meanwhile, this tumor is growing in the lumen. They would only get symptoms when it completely blocks off, but as it grows out this way, it also grows out that way. The cure rate goes down to around 40% once it's growing outside the colon. Cure rate's above 90% when it's inside the colon. So that's why we like to screen people when they feel good, look good. I call them, if you're part of Young and the Restless, that's the time to get screened.
So having a colonoscopy early, particularly when you're asymptomatic, really saves lives. Now, there are 2 other possibilities you could find in terms of polyps. You can find a hyperplastic polyp, which has no malignant potential, and then an adenomatous polyp, which essentially tags you for future studies, correct?
Correct, yes. So if after 50 years of life you have a colonoscopy and you have no polyps, your risk of forming polyps in the future is very low, so we rescreen you in 10 years. If after 50 years of life you have polyps, 1 or 2, they get removed. And if they're adenomatous, which is the tissue type that can turn into cancer, we rescreen you at 5 years. There are certain people that have large polyps, or if you have more than 5 polyps, we rescreen you at 3 years.
Over the last several years, new technology has brought us another option. This option may be available to you depending on what your doctor says. Now, this involves obtaining a stool sample for a DNA analysis of your stool, as well as a search for human hemoglobin. So the kit is actually sent to you if you qualify for this test. This is the container that actually collects the stool. It's placed on a special plastic platform that fits under the toilet seat, and you obtain the stool sample. Once you have the sample, you use a special wand to scrape the sample. The instructions are very clear. This wand actually picks up small amounts of stool on the surface of the stool and is also sent to the lab along with the stool sample. And this is all done at home, and then you take it to UPS and have it sent off to the lab. The lab then is looking for exfoliated cells of either tumor or polyps. It's a very sensitive and specific test. Now, why is this such a great option for people? Because unfortunately, only 1 out of 3 Americans actually get tested. Many Americans are actually afraid of the colonoscopy or just can't find the time. But remember, 1 out of 20 Americans gets colon cancer. It's a very, very important thing to get screened. So there you have it. It's colon cancer screening month in March, so ask your doctor what your options are and make sure you get screened.